Okay. Gonna demonstrate foot care skill. I know this is skill number 19, correct? All right, so for this, we'll need a towel for my barrier for the table. This is gonna be a waterproof chuck. This is gonna go underneath the feet. This is gonna be a towel to dry the feet, and 2 towels, 1 to wash, 1 to rinse, and then my gloves, soap and lotion, basin. Hello, good morning, Mr. Jones. My name is Dante, and I'm here to perform foot care. How does that sound? It sounds good? I agree. All right, real quick, what I'm gonna do is I'm gonna go wash my hands. I'm gonna gather my supplies, and on my way, before I am on my way, I just wanna confirm it is you, Mr. Jones. Wonderful. I'll be right back. I've noticed that your bed is at its lowest level, so you're gonna be safe during the time I just go get my supplies and wash my hands. So I'm gonna go wash my hands. I've got my supplies. I'm back in your room, Mr. Jones, and I'm gonna get my barrier for your overbed table. So that way I can place my supplies on a clean surface. So now I'll put my supplies on the surface. I got all my supplies I need. Soap, lotion. I'm gonna try my best to separate the dirty and clean, because I'm gonna put whatever dirty I have on this side, so I can keep my clean articles on one other side. For this, I'm gonna need to keep your bed at the lowest level, because I'm gonna go get some water for the basin, okay? I'm gonna go ahead and provide some privacy while I'm gone. I'm gonna go to the bathroom and get the water. It's nice and warm, and I'm gonna check to make sure it's nice and warm. I come right back to the patient. I'm gonna ask Mr. Jones to check the water. He says, yes, it is perfect. All right, so keeping you covered. I'm gonna place this just here for now. So for this, I'm gonna expose the patient's foot, but for the sake of it, there's no wrong time for this one to put on your set of gloves. For this, because I'm gonna quickly come in contact with his foot right now, I'm gonna go ahead and put my glove on, come back to the patient. I'm gonna get the remote control, lie them flat on their bed. Since I'm doing this procedure in the patient's bed, it just makes more sense to me to do this in the patient's bed, rather than have them sit up in a chair or have them get out of the bed to sit in a chair and then do my field while they're sitting in a chair. Also, it's more stressful on the back. So, got my gloves on, I raised the bed to waist level. I can go ahead and still touch everything since my hands have not been soiled. Now, I'm going to expose your foot. I expose your foot. I notice that you're wearing socks on both feet. This is just gonna be a skill on one foot. But because he's got a sock, I'm now gonna get my barrier. I got my barrier. Roll away is dirty. Rolling towards you is clean. So I'll place this right under your foot. And excellent, there we are. So I'm gonna go ahead and remove your sock. I'll place this on the barrier so I can put that back on your foot when we're done. But I have the water here. I'm gonna bend your knee to put your foot into the basin. All right, there we go. The foot is in the basin and your foot is soaking in the basin, okay? This is when I'm gonna get my first towel, my first washcloth, and I'm gonna get my soap. I'm gonna soap the washcloth, get a good lather. I'm gonna support the heel of the foot. I'm going to apply the first layer to the top portion of the foot. So just wipe down like this is all you need for the state test, okay? You're going to change that leaf. So I have another clean surface. I'm gonna get this side of the foot and this side of the foot. Then I'm gonna get another clean surface of the towel. This is gonna be the bottom. So the heel to the bottom of the foot. This last one, I'm going to clean the toes, especially in between the toes. Very good. All right, now I can place this even on the barrier of the bed right here, or I could place it on my towel, I mean on my bedside table, either or. I'm gonna go ahead and dunk your foot back in the water. I'm gonna get my other washcloth. I'm gonna get that one wet. Now I'm going to rinse. Supporting at the heel, the same method. The top, the sides, the bottom from heel to the ball of the foot. And then this last one is going to be the toes, and especially in between the toes. All right, very good. Now I can go ahead and get my other washcloth, and I can get the basin. I can put the foot right down onto the barrier for right now. So I can remove this and place this onto my bedside table, where I can get my towel. I'm gonna fold my towel. I'm gonna keep it in a half fold, and I will place this under the patient's foot, where I can now dry the patient's foot. All surfaces of the foot I'm gonna dry, especially in between the toes. So now that I've dried the foot, I can go ahead and place this right here. In fact, I'm gonna go ahead and keep the towel in place. I'm gonna get my lotion, get the lotion. I'm going to lotion up the bottom of the foot, heel, and the top of the foot, but not in between the toes. I have this towel here, still clean. This is a clean surface of the towel. I'm now going to wipe any excess lotion that I have on the foot. That excess lotion has been removed. At this point, I can remove the towel completely and place the sock back on the patient's foot. Now that that's done, I'm going to remove the barrier. I can now cover the patient's foot with their towel. These contents here, I'm going to go ahead and open this up. I can remove my towels. Will go into my soiled linen container. And if this is the trash, with my gloves, they went inside the trash chute. Okay? I have my gloves on, so I can be able to at least take care of the rest of these articles. My soiled linen container. And now, gosh, patients at a high level, waist level, if that, I need to remove this tub and take it to the bathroom. But before I do that, I'm gonna remove these gloves. I'm gonna sanitize my hands. Now I'm gonna come over to the patient. I'm just gonna make sure that the bed is set to its lowest position. So that way, if they fall out of bed while I'm on my way to the toilet or to the bathroom, that if they have an accident, they're not gonna be too far away from the floor. So, bed is at lowest position. I'm gonna go ahead and put the call light in reach. If the remote is in access, and if they would prefer to have their head of bed changed into a more comfortable position, I can do that for the patient too. Basically, this is the closing. I already closed the patient out. Now they're ready to, when I'm done, they're done. I'm now going to put on my second pair of gloves. Second pair of gloves go on. I'm gonna remove the soap and lotion. I'll put this in its designated area. I can remove the barrier from the table. I will place this into its soiled linen hamper. Take this to the bathroom, or I would get my paper towels, turn on the sink. Because this is just foot, where can I dump this water?
The sink.
I can place this in the sink, right? Or the toilet. It doesn't harm if it's in the toilet or in the sink. So I'm gonna throw this in the sink, the water's on, rinse that out, rinse it out, turn off the faucet with my paper towel, I throw that in the trash, get all my paper towels I need to dry, throw that in the trash. Now this would go into its designated area. Remove my gloves, throw them in the trash, sanitize his hands. I'm now gonna enter the patient's room again. just to confirm that the patient's still in his lowest position, call light is still in reach now, and the patient states he's comfortable. Open curtains, wash his hands, skill is complete.